What's going on, ladies and gentlemen? It's your boy Nurse Bass back with another video. And in this video, what I have for you guys is another episode of Ask Bass, where we take questions from you guys, the subscribers out there, and we answer them here on the channel. And this particular one is about getting over the grade. Let's dive in.
Are you listening? Nurse Bass. Beast mode. Grind.
So before I dive into this video, I wanted to thank you guys, man. Those of you who have been coming through and supporting the recent content. I've been back dropping content consistently now for about 2 months or so, and I'm just so overwhelmed by the support. You know, I know that I've been MIA for quite a long time, and those of you who are coming through and take a benefit away from the content, I'm very happy to see it. And if you are subscribed, hit that bell notification. YouTube's been slacking. Notifications are not going out. So if you do want to make sure that you don't miss any future content releases, just hit that bell. So this particular comment is coming from a subscriber for a few years now, and I wanted to make sure that I got around to this. So without further ado, let's dive in. I know this is kind of off topic. However, I'm a 22-year-old. I've been watching you since I was about 19 or 20. Appreciate you. I am currently in my first semester of nursing school. I took my first exam today for theory, and I scored an 82%. I know I should be so proud of myself for passing, but compared to my classmates, a lot of them scored an 85% or higher. I know that I should not compare myself to others for an abundance of reasons, but I'm just having such a hard time getting over the grade. Any advice on how not to feel this way? So I thought that this was a super important video to make because, you know, what I really want to do here on this channel is motivate, uplift, and inspire you to be the best nurse you can be. And I want to share comments and video topics that just possess relatability, things that anybody who's been through nursing school can relate to. Okay, I've been through it. A lot of you guys are currently going through it, so I thought that this was very important to talk about. Whenever you're in nursing school, okay, I've mentioned this before, but you're going from prereqs into nursing school. It's a completely different ball game. You're not just memorizing and brain dumping information. You're memorizing it, and like, you need to carry this forward to the next semester. You need to carry this forward to the next semester, and so on and so forth. And it's the kind of thing that you're actually storing away to then put into actual use in the clinical practice. So there's the old common adage, C's get degrees, right? But it's whenever you're going from prereqs into nursing school and you start getting all these crazy select all that apply questions with answer choices that sometimes may not even make sense or be in the same realm of logic, it's a different beast, man. And so whenever you start getting these grades back and they are not maybe the A's that you're used to getting, in this case, our friend here got an 82%, it can be certainly disheartening. Now, on one hand, yes, it's difficult to be happy about that grade and say, hey, I got a grade that's passing. At least I'm passing. And to not kind of beat yourself up a little bit about it, especially whenever you're used to doing so well, perhaps. First thing that I wanted to do before I dive into that is this component of comparing yourself to other classmates. Now, this individual said that they're aware that there are abundant reasons as to why you should not do that, but please try not to get into a habit of that. You know, it sounds like you're in your first semester, so it sounds like, you know, you're brand new into things. Just try not to get into that habit, okay? It's normal for anybody to try and, you know, hey, so how did you do? And then you kind of gauge yourself against the rest of the class just to get an idea for, hey, how the heck am I actually even doing in this class? That's normal. But again, you're in the very beginning, so try not to get into a habit of that, because that kind of thing, carrying forward semester after semester, is the kind of thing that's like an anchor tied to the ankle, preventing you from progressing forward. So nonetheless, actually diving into how to get over this feeling, how to get over the grade.
Hey guys, real quick, I just wanted to let you all know about this amazing company called nursing.com, whose sole purpose is to help prepare aspiring and new nurses for success in this rewarding career. Links down below. They have 4 brand new academies available for whatever stage of the grind you're in. The pre-nursing academy for those aspiring, the nursing student academy for those in the trenches, the absolutely stellar NCLEX prep academy with over 99% pass rate, and a program designed to help the new grad nurse navigate this new and intimidating profession. Just pick the path that's right for you. But if funds are tight, don't worry, because nursing.com has a ton of other free resources available to you as well. One day, patient lives will be in your hands. Study like it. Links are in the description. Love you guys. Grind on.
It's really to understand that whenever you took this exam and you got an 82%, how confident did you feel about the information that you studied? How confident did you feel about the answer choices that you were given? Or about the answers that you gave, I should say. if it's the kind of thing where you scored an 82%, but damn, like I put in a lot of hours into this studying and I thought that I did well in the exam, but now I've got an 82% in front of me. Okay, well, this is the kind of situation where we need to take this exam, and hopefully your professors are offering this. Most should. Take this exam to the professor after whenever their office hours are available, and you need to have a conversation with them. Like, I would really like to go over my exam. You don't have to show me anything, but maybe I need some clarification on these answers that I got incorrect. It's the best way that you're able to build knowledge and grow. And so that right there, what I just said, is the most important component. Okay, what we're trying to do here is we're trying to build knowledge and we're trying to grow. So understanding that almost regardless of what the grade you got was, whether it was a 78 barely on the line of passing or it was a 100, you need to understand, do I understand this information that I'm studying and that I'm being tested on? And if not, if there are deficiencies in that part of the process, then that is where the corrections need to be made. I honestly, like I've said before, okay, what we're doing here in nursing school is we're studying to build knowledge, to be able to care for human lives, right? And I try not to beat a dead horse with this, but I want to keep things in perspective. Again, one day patient lives will be in your hands. Study like it. What are we doing here? Okay, so ask yourself that question. And so with that in mind, if you go through let's say you've got 4 chapters in fundamentals of nursing that you're going to be tested on, and you study those 4 chapters and you can recite it to the wall, you're able to teach it to the wall, you know the information so well, and then you get a test and you make an 81% or an 83%. Okay, well, there's a discrepancy, there's a disconnect between what you studied and what you were tested on. And so again, that's where the follow-up with the teachers are in their offices are so important. Like, why did I get these questions wrong? But at the end of the day, if you knew the information so well that you could teach it to the wall, then I would just rest assured in that, okay? Because yes, it gets nerve-wracking if you make an 82% on an exam to say, well, damn, like benchmark is 80%, for instance, and I just made an 82%, like, God, now the stress and anxiety is even compounded even further because next exam I got to make sure that I do well. I don't want to drop below that average. I understand that, and that's kind of a very bad feeling to have, and that can certainly be stress and anxiety inducing. But just try and take some comfort from the fact that, hey, I knew this information, and that is what's most important. That's what's paramount. You're going to need to know the information so that you can pass the licensure exam, but ultimately so that you can care for patients. So the best thing that I can say is, again, just use the resources that you have available to you. Go talk to your instructors as you need to. Clarify until you get the clarification that you need. And just continue to pour yourself into your studies, and the grades will fall where the grades will fall. But you know, as long as you're not in danger of failing, and if you are, then there is some, like I said, there's a serious disconnect, and some work needs to be done there. But you're certainly capable of doing it. And 82%, I would try just to take a breath. Take a breath. Things are going to be okay, all right? And if anything else, flip that and use that for even more fuel and even more motivation. It's like, shit, maybe I did study it till I was blue in the face and I knew that information, but I still scored an 82%. Well, I'm going to use that even more fuel to make sure that the next test that all the information I get studied on or tested on there, I know even better. And, you know, just further compound that feeling of refinement until you are a polished product, fire nursing student doing, you know, feeling confident about yourself. Again, try not to be too concerned with the grades, ladies and gentlemen. I'm sorry for rambling. I hope that you enjoyed this video, and I hope you took benefit away from it. Anyway, it's your boy Nurse Bass. If you're new to the channel, please hit that subscribe button. We're putting out content every week to motivate, uplift, and inspire you to be the best damn nurse you can be. And if you're already subbed, hit that bell notification, please, if you're interested in getting future content. I'll see you guys in the next video. Peace.